Hello, and you're very welcome to the HRB Where Are They Now series, where we are celebrating and reflecting on 40 years of the Health Research Board. I'm your host, Dr. Claire O'Connell, and yes, can you believe it? The HRB is 40 years on the go, and in those 4 decades, the HRB has supported an enormous amount of research and researchers who have worked to support and shape health and social care in Ireland and beyond. And to mark the occasion, as the name of the series suggests, we are speaking with people who at some point in their career received support from the HRB or who reflect the HRB's priorities. In this episode, we are joined by Professor Ian Kelleher. Ian, you're very welcome to the series.
Hi, Claire.
So Ian, you're a consultant psychiatrist and also a renowned researcher in the field of psychiatric epidemiology, and your work focuses on early life predictors of severe mental illness in later life. And today you're based in Scotland, in Edinburgh, as the chair of Child and Adolescent Psychiatry at the University of Edinburgh. And you're also working as a clinician, so you're very busy. But tell us a little bit about the research that you're doing today.
Yeah, so my focus and my research is trying to understand the trajectories of young people's mental health and understand them not just when they present to us for the first time in Child and Adolescent Mental Health Services or CAMS, where I work, but understand where those processes or trajectories will take them over time. And so understanding long-term outcomes. And of course, it's very important to think about the young person's mental health right now, but we also want to really know about what their mental health is going to look like in the future, and can we do something to ultimately improve those long-term outcomes.
And what kind of things do you look at then as these style of, I suppose, predictors or signals that somebody may be at higher risk later in life?
Yeah, so we use a lot of different types of studies, but especially big registry data. And so we use registry data from here in Scotland, from Wales, from Finland, from Denmark, from Sweden, countries that have built these impressive registries that capture every time you come and see a doctor, every interaction with the health service, every diagnosis, in fact, every treatment. And it allows us to better understand things like how treatments that may be delivered in CAMS impact on your long-term outcomes. So as an example, we're interested in risk for severe mental illnesses, and so we can see that actually a lot of the people who will go on to develop severe mental illnesses in adulthood, like schizophrenia or bipolar disorder, have come to CAMS earlier in their lives, usually for very different reasons, maybe for anxiety or depression or ADHD or autism. But we want to understand, is there something we could do in CAMS that could change that outcome, that could reduce the risk that somebody goes on to develop a severe mental illness in adult life. And so we take data from these registries and we link information on who came to the clinical services, what treatments did they have, and then we model this using techniques called causal inference methods, where we try to understand the cause and effect between what they were treated with and what their outcome was.
Okay.
And part of that is because doing research often involves doing randomized controlled trials. But randomized controlled trials aren't amenable to all areas of medicine and healthcare. And if you want to look at long-term outcomes, for example, randomized controlled trials really aren't very feasible because you need to follow huge numbers of people over very long periods of time. And that's where having health registries is really important. It means that we can follow everyone in a population, and we can follow them. In our case, we follow people sometimes for decades to look at their outcomes.
So you have those rich data sets, as you say, of people's journeys through the system, and you can look at specific aspects of their treatments or their diagnoses, and use that information instead of trying to set up a massive trial of thousands and thousands of people and following them kind of live as they go through. Very good, very good. And I suppose what sparked your interest first in medicine and then specifically in psychiatry, Ian?
Yeah, so I remember the kind of earliest spark of the interest was when I was still quite young, and my mother was she was studying for a degree in UCC, and one of her subjects was in psychology, and she had a textbook on developmental psychology. And I remember finding that really fascinating. I can remember as a teenager reading it, thinking, "Oh, this is a really interesting area." Never predicting that was going to result in me becoming ultimately a child and adolescent psychiatrist. But I think that probably helped to really spark my interest. And it also was a real interest just in people, why we are the way we are, how we become who we become, how does nature and nurture feed into our development, and also then ultimately thinking, it's a really rewarding thing to work in. It's very rewarding to work as a doctor, to spend your focus on trying to help people.
Oh, very good. So that signal was there for you in adolescence. You were reading that textbook and getting interested in that developmental psychology. And in terms of, I mean, obviously, you work as a clinician, you're also a researcher, you're very invested in the data and everything. Where did that interest come from? Have you always been someone who's been very interested in evidence and data?
Yeah, I mean, I think that's a really interesting question. Where did that come from? I think that in my family, there was always a lot of, there were four of us who were close in age, and, like all families, we were constantly debating and arguing with each other and trying to get one up. And of course, if you have some evidence about who's right, that's really valuable. So it probably goes right back to that too. And it also goes to seeing that having evidence-informed services leads to better outcomes for patients, right? So if you want to have a good outcome for the young person coming to you, well, there's no shortage of opinions, let me tell you. When you're a psychiatrist, everyone wants to tell you their opinions on young people's mental health. And that doesn't matter if you're sitting in a taxi, it doesn't matter if you're sitting with another colleague, you're working in healthcare, from social workers, psychologists, psychiatrists. Everyone has their opinions. And I found that really just unsatisfactory in trying to help my patients. I didn't want to know what someone's opinion was. I wanted to know what the evidence actually shows. And that's really what drove me to try to be more critical in the way I look at things, and make sure that we are taking these data-driven approaches, looking at what the data says and actually letting that inform what we do. Because there's been a lot of mistakes in the history of medicine, right? People have got things wrong. And where things have gone back on track to get things right is when we have not followed opinion, but followed evidence.
Mm-hmm. Absolutely. And in terms of how the HRB supported you on that journey, sort of, going through developing your research in psychiatric epidemiology, at what point did the HRB support you, and how did that happen?
Yeah, I was reflecting on that, thinking that, people have a certain idea or image of how science and research take place, and that typically involves thinking of people working in laboratories, doing experiments, or sitting at computers using big data, and it rarely includes an image of the research funder, right? But this is at the core of scientific work. None of the scientific work could be done without them, and the research funder is an intrinsic part of the research process. And so I have been lucky enough to have years of HRB funding, and my major award from the HRB came 6 years ago, back in 2020, when they funded me to spend half of my clinical time in research. And that really came, I think, from the HRB's desire to put evidence at the base of what we do in the health service. As I'm saying, we need clinicians to be clinician scientists. We need that activity from them, and that's what's going to ultimately improve our services. And so their funding for me meant I could spend some of that time in research. It means I could grow my research team, grow the numbers of research questions that I could ask. And rather than just being reactive in clinical services to what might be happening in the population at any given time, actually shaping our answers to what we should do, or how we can understand how best to help young people coming to us.
Great, because I think, from speaking sometimes to clinicians who are doing research where their time hasn't been supported, in that way, the research can be something they're doing at the evenings, at the weekends, in their spare time, and they find that very frustrating. So it's very encouraging to see how supporting clinicians to do research can make a difference, as it has in your case.
Right, and research is tough. It's hard to get right, and you need to be invested in it. And that includes investing your time. You need to, it involves a lot of reflection and thinking and improving and discussing and debating, and And of course, it's great to have as many clinicians active in research as possible, but you certainly need people who have the time to dedicate to the research. And it's great to have that balance too, where people are still embedded in clinical services, and that clinical service and the experience there feeds into the research questions, and similarly the research feeds into developing the clinical service. But that's a really, really important cycle.
Yeah, so it's iterative. I suppose if you could go back in time to younger Ian, who was just starting out on the career in psychiatry, what would you say? What would you say to younger Ian?
I guess I would say that that understanding the value of data and how to analyze and use data in a way that can answer clinical questions is really valuable. So investing in developing the skills to do data science research, to be able to take these massive registries, and the registries that we look at have millions of people in them and billions of data points in them, and so they're complex, and to make the most of them, you need to understand how to use those data sets. And so that's something that's important. The reality, though, of course, is I think all the experiences you have along the way lead you to where you are now, and I probably wouldn't actually change anything.
Good. That's good to hear. Well, thank you so much, Professor Ian Kelleher, for joining us on the HRB Where Are They Now series. And if you'd like to find other episodes, you can check out the HRB YouTube channel. But for now, from me, Dr. Claire O'Connell, Slán, and thanks for joining us.